Okay, everybody. Thank you for paying attention to all of these videos. This is our last one, and it is a big one. So we're moving into digestive health. I really have tried to summarize digestive health issues the best that I can. There are a lot of problems people can have with their guts, and I may not cover exactly everything that you're interested in learning about today, but I'm going to do my best to give you a broad overview of gut health. So, I do just want to say that I have a very healthy respect for the GI tract, and I don't think that digestive symptoms should ever be minimized. So, supplements, diet, and lifestyle are not going to fix a structural abnormality. Supplements, diet, and lifestyle can help conventional medicine treat serious digestive diseases. Sometimes conventional interventions need to be implemented first, and then lifestyle changes can help to prevent future issues from arising. So, when it comes to understanding digestive symptoms, you are a big piece of a big source of information. Okay, so it's really important to keep a journal. How long have you been having your symptoms? When did they occur in relationship to eating a meal? Are symptoms improved, unchanged, or worsened by eating? When during the day are symptoms present? All day, morning, afternoon, evening? Are symptoms improved when you go to the bathroom? Are symptoms improved by belching or passing gas? Are symptoms triggered by stress or by doing specific activities? So keep a journal. Okay, that's really helpful. And then when we think about digestive symptoms or symptoms that happen across your abdomen, there's a lot of things that are happening in there. Okay, there's a lot in between your rib cage and your pelvis, so it's helpful to think about symptoms being upper GI, kind of across the middle, or lower GI. And sometimes putting together a timeline can really help us think about how to approach testing. So, upper GI symptoms are things like reflux or heartburn, which is different from reflux, food sticking on the way down, frequent belching, a decreased appetite, bloating, sort of right up in between the rib cage. That's what we call epigastric pain. Okay. Burning sensation in your stomach after eating. Chronic sinus infections are actually a symptom of upper GI problems and a chronic cough. So, there are a lot of common causes of upper GI symptoms, things like diet, gallbladder issues, low pancreatic enzymes, constipation, food allergies, celiac disease, H. pylori, menopause, low stomach acid, nerve dysfunction, connective tissue disorders, inflammatory bowel disease. There's a lot. So, reflux is a very common symptom that people complain of, and it's really important to just visualize what's actually happening there. So there's no flap sort of at the back of your throat. There's really a bundle of muscle tissue that sits right between your stomach and your esophagus. This is your diaphragm right here. Okay. So right here is what we call the GE junction. And this bundle of muscle tissue sits halfway above and halfway below your diaphragm. When you swallow food, negative pressure actually allows that food to go down your esophagus. Then when it gets into your stomach, we've got positive pressure that closes this bundle of muscle tissue, and then your stomach can do all of its work, digesting your food, and hopefully nothing goes back up again. When we get a hiatal hernia, that bundle of muscle tissue gets pushed up into the chest cavity. That's the hiatal hernia. When you have an EGD, an upper scope, your doctor will measure how big your hernia is and will tell you it's 1 centimeter, 3 centimeters, 5 centimeters, something like that if you have one. Okay. There are a lot of reasons we can get hiatal hernias: pregnancy, weightlifting, intense exercise, weight gain, constipation, injury or trauma to the area, frequent vomiting, or even just having the chronic cough. It is important to distinguish between reflux or heartburn. So, reflux may not always burn, and that's actually concerning because it means that your esophagus has become desensitized to acid, and we actually really don't like that. So that's where that whole silent reflux comes in. Health risks from untreated reflux include exacerbation of asthma, which can even lead to COPD over time. So, and again, chronic sinus inflammation and sinus issues, and then Barrett's esophagus, which is precancerous changes, and then actually esophageal cancer. H. pylori is a bacteria that can live in the lining of your stomach. It's often asymptomatic, but it actually decreases stomach acid, which is then what contributes to the reflux because we need hydrochloric acid in order for your stomach to move properly and digest your food. And when H. pylori is left untreated, it can actually cause peptic ulcer disease. Menopause actually can contribute to some upper GI issues and reflux because we need menopause to help, or sorry, estrogen to help stimulate hydrochloric acid production. So when estrogen levels drop during and after menopause, then the decreased hydrochloric acid can lead to poor digestion, which then leads to nutrient absorption and reflux, decreased nutrient absorption and reflux. And then that in turn can even lead to things like osteoporosis, anemia, or B12 deficiency. Again, talking about reflux, diet can contribute to reflux. So, caffeine, alcohol, and mint are all smooth muscle relaxants. And again, that GE junction is just a bundle of muscle tissue, which is smooth muscle. Also, food allergies and sensitivities can trigger an immune response 30 minutes to 72 hours after consumption. So, I've seen people allergic to the craziest things like cinnamon, vanilla, things that you wouldn't really think about. But when they eliminate those from their diet, their GI symptoms improve. So, interesting things to learn. Constipation can cause upper GI symptoms because when we get stool going across that transverse colon, that's putting pressure right on your stomach, and it's going to make you feel like it's your stomach that's full, but really it's your colon. And I do want to make sure to impress upon you the fact that you can move your bowels every single day and still be constipated. The goal isn't just moving your bowels, it's emptying your bowels every day. Then we're going to see gallbladder sort of pop up in a couple different places, but we can get gallbladder dysfunction that can contribute to upper GI symptoms because sometimes that bile will actually go all the way back up into your stomach, and that can be very uncomfortable. Testing for upper GI complaints is important, and I rely on conventional medicine approach to testing. I can order a lot of these things for you, but sadly, I cannot do some of them. Like I can't do your EGD, I can't do your HIDA scan. I used to be able to do a 72-hour page Bravo study on you, but I can't anymore. So uh, I rely on regular testing in order for us to really be able to collect the most appropriate data. And so these are some of the things that we can request to have done for you. Or you may have already had them done, and I can take a look at your results. If you have suffered from reflux or heartburn for more than 6 months, it really is a good idea to just schedule an EGD and have somebody go down and take a look. Then you can bring that information to me and I'll tell you what to do with it. I don't want you to just get on a bunch of PPIs, but I do need them to do the test. Somebody needs to go down and take a look at what's happening in there, okay? And then get biopsies. We really do need biopsies in order to make sure that you don't have any kind of precancerous changes going on, and they can let us know if you've got H. pylori or celiac disease or inflammation in the lining of your stomach or your esophagus. So again, even as a functional medicine provider, I really do rely on EGD and biopsies to help guide my treatment plan for you. Middle GI symptoms, I put this in here just because it's really the things that sort of happen right around your belly button. So bloating across your mid-abdomen and really loud bowel sounds, abdominal pain across your belt line. Common causes of middle GI symptoms include things like gallbladder dysfunction, low pancreatic enzymes, small intestinal bacterial overgrowth, inflammatory bowel disease, celiac disease, ever-present constipation, even an enlarged liver, food allergies and sensitivities, connective tissue diseases, and inflammatory bowel disease. So, a really concerning cause of sort of middle GI symptoms might be something like a small intestinal stricture. It is not very common, but it is very serious if it happens. Small intestinal bacterial overgrowth is when we get colonic bacteria, so bacteria that are fermenting that belong in your colon and they like to move into your small intestine. When they do that, they will release gas and make you feel very uncomfortable. Okay, with too many fermenting bacteria in your small intestine, you will feel bloated and you may belch. And that trapped air definitely gives you that pain across the belt line. Then we have everybody likes to call leaky gut, which is really just highly permeable gut membrane. And that can happen when we get food particles and bacteria that leak into the lining of the GI tract down here, causing inflammation and irritability in the lining of the intestines. And if left untreated, this can trigger autoimmune disease or chronic systemic inflammation. Gallbladder dysfunction can really just wreak havoc across your entire GI tract. If you've got sticky bile that is sluggish and it causes gallstones, and then you need to have your gallbladder removed, then we really get left with a lot of problems because then you don't have the gallbladder to keep bile out of your GI tract anymore. Now you just have bile leaking everywhere. And that can definitely be uncomfortable. Constipation is a real problem. So you get pain sort of all over your abdomen when you have constipation, and a full colon causes pressure across your whole midsection. It can put pressure on your liver, on your stomach. So it can lead to chronic reflux and inflammation, and even lead to needing an appendectomy. So, GI testing for middle digestive complaints includes breath testing, doing imaging, HIDA scan, or even functional gut health testing. So, things like the GI map, which is an absolutely wonderful test that I do like to do a lot on my patients. Then we have lower GI symptoms, and these are common things like constipation, diarrhea, passing a lot of gas, but then even things like difficulty with defecation. So, narrowing of stools, black or bloody stools, underweight, and even chronic anemia. So, we need to always know, why are you not making enough red blood cells? What's going on? Are you losing some of them from somewhere that we haven't identified yet? So, common causes of lower GI symptoms include like too many bacteria, connective tissue disorders, nervous system disorders, poorly treated diabetes, inflammatory bowel disease, food allergies or sensitivities, a lack of fiber, and even things like pelvic floor dysfunction, heavy lifting, multiple pregnancies, colon cancer, and ever present stress. Pelvic floor dysfunction is something that I think is often underdiagnosed, but it can happen in both men and women. It's often overlooked as a cause of chronic lower abdominal symptoms, especially in men, which is very sad for you guys. The most common signs can include things like a sensation of fullness in the rectum, but difficulty moving your bowels, going to the bathroom multiple times, knowing that you're really never going to empty that first trip. Sometimes we see narrowing of the stool, so pencil thin or ribbon-like stools, and definitely noticing that you need to strain harder to move your bowels. So if left untreated, those symptoms can cause a loss of your normal function. It'll just continue to progress. We definitely see a lot of bacterial overgrowth or undergrowth when just across the board right now. So I really do like to do functional gut health testing like the GI map in order to really know exactly where do we need to rebalance your gut. Many people take probiotics, but I often, if you don't really know who's missing, how do you know who to replace, right? So I really recommend gut health testing if you've been experiencing digestive issues. Also, we know about prebiotics and probiotics, but there's also something called postbiotics, and that's the short chain fatty acids that your bacteria produce. And those help to regulate your immune system, your stress response, and balance your mood. So, taking a look at how well your bacteria are working for you is really important. So, bacterial overgrowth or undergrowth can certainly be caused by things like chronic parasitic, viral, or pathogenic bacterial infections. Methane producing bacterial overgrowth leads to constipation. Hydrogen producing bacterial overgrowth leads to diarrhea. And if left untreated, the digestive tract really is susceptible to infection. Chronic inflammation, autoimmune diseases, mood dysregulation, and fatigue and malnutrition certainly can result. This is more upper GI, but pancreas or gallbladder dysfunction can then lead to things like loose stools and diarrhea, okay, or fecal urgency. And if you're chronically not properly digesting your food, that can lead to malnutrition. But also, if you've been having chronic pancreatic dysfunction, that can even lead to pancreatitis. Stress is often manifested in the gut. It decreases your intestinal motility, so like how well your intestines contract to move things through. It increases your inflammatory markers, and stress increases or impacts your microbial balance in as little as 24 hours. We also have the gut-brain axis, and that's continuously being, there's a continuous bi-directional flow of information from your gut to your brain. And your microbiome actually produces neurotransmitters that can affect your central nervous system. 90% of the serotonin that you make is made in your gut. Inflammatory bowel disease is certainly an issue many people have, and we have two kinds, Crohn's disease and ulcerative colitis. Being treated for inflammatory bowel disease by conventional therapies is certainly important, but functional medicine can help you to maintain benefits that you're getting from conventional medicine providers. People are often concerned about colon cancer, and it is something to be aware of because it's one of the more preventable kinds of cancer. Generally, colon cancer is slow growing, but if you are a younger person who has developed it, usually you would develop a more aggressive form. So, having bright red blood in your stools or having a change in your bowel habits, unexplained weight loss, feeling chronically fatigued, can all be signs of colon cancer. So, making sure that you're getting properly screened for that is important. Testing for lower GI symptoms can include things like colonoscopies, imaging, stool testing, and functional gut health testing. So once again, you are a very important collector of information just when it comes to understanding your digestive symptoms. So again, how long have you been having your symptoms? When do symptoms occur in relation to eating a meal? Are symptoms improved, unchanged, or worsened by eating? When during the day are your symptoms present? Are symptoms improved when you go to the bathroom? Are symptoms improved by belching or passing gas? And are symptoms triggered by stress or specific activities? Do keep a journal. Then I like to do the GI map. There are some other functional gut health tests that I also include, but this is probably the most common one that I do. Yay, you made it. Thank you for watching the entire Rooting Your Tree of Health educational series. I hope this was helpful. And Charles Swindoll has said, life is 10% what happens to you and 90% how you react to it. So I'm here to help you react in the best way that you can to maintain your health and get rid of your unwanted symptoms. Take care.